I'm Dr. Mickel. I'm the chiropractor and clinic director here at Integrated Health Solutions. I've been in practice for 25 years here in Vancouver. What I noticed early on in practice is that what I wanted to get out of chiropractic and what I was able to deliver for patients are two separate things. I had a couple that came in and they told me, "You're a very nice young man, but you weren't able to do the things that old chiropractors were able to do." They told me they had ways of assessing and finding the right things to adjust. And that really lit a fire in me to want to go all over the country and learn from as many people as I could. So over the 25 years, I've learned over 20 techniques. And when people come in, I start with an assessment where I look at the kinetic chain from the head through the entire spine, through the pelvis, the knees, ankles, and the feet. I use your body as a biofeedback device. I'm looking for weaknesses, and they show up through a series of pushing and challenges of the joints of your body. Once we find something that is weak, we perform an adjustment, and then we have to retest to make sure that we now have strength in that area. Most chiropractors, I'd say, are excellent at adjusting, but they don't have the ways of finding what really needs to be adjusted. Beyond the adjustments, we have to find out how we can help the body in the areas where it's compensated, because that's where the muscles are sore, that's where the inflammation is, that's where the body is breaking down because it's working so hard in those areas. The main technique I use is pain neutralization technique from Dr. Stephen Kaufman out of Denver, Colorado. It seems to work on the neurology that's within the fascia, and it literally neutralizes pain. When you neutralize pain, you stop the brain's reaction to pain. So everything relaxes, we have good circulation, we can bring in the things that help us heal and flush out the things that need to get out of there, like the inflammation. I've never seen anything that works better. I also utilize a technique called quantum neurology to assess neurological function, both in our cranial nerves and then in the proprioceptors all around the body. So if we find structural weaknesses, restore circulation, and find neurological weaknesses, we've really optimized the body's potential to heal. So if you're dealing with a frustrating chronic issue and you're looking for a different approach, I'd love to show you our unique brand of chiropractic care, where we look at that kinetic chain, improve circulation and tissue dynamics, and get your nervous system tuned up.